Okay, we're going to go ahead and get started. So thank you all so much for joining us today. My name is Lauren. I'm one of the educators here at Iris. I'm joined by Corey, also an educator here at Iris. So you may have seen us visiting you on site or conducting trainings virtually or in past webinars that we've held. So we really appreciate you taking some time out to join us this Friday for discussions about your discussions with patients. So as you all know, we are conducting periodic webinars throughout the year on various topics to hopefully help you bolster your understanding about the exam. And so we cover a variety of topics. The webinars are recorded and they are always available on our YouTube channel on the webinar playlist. And we do include that link in our newsletter. So if you or your colleagues ever miss a newsletter, or excuse me, a webinar, you can always look at our newsletter to get that information from the past webinars, or you can go to our YouTube channel to access previous topics. We're very excited for our upcoming webinar in November. We'll be hosting Dr. Gross. He is the IRIS CMO, and he's going to be speaking with us about various eye conditions, how they affect patient vision, and the importance of early detection through exams like the IRIS exam. So that'll be a really interesting one. So be on the lookout for information on that. Just a general reminder on the webinar abilities. You will not be able to come off mute and speak, but there is an option for you to put questions in the Q&A box. So we invite you at any time during the webinar, if a question comes up for you, go ahead and put it in that Q&A box. We will be monitoring that throughout the webinar, and we'll take some time at the end to make sure that we answer your questions. If your questions are specific to your organization, your camera, or your workflow, we may not answer them live. In those cases, we will follow up with you individually. So feel free to ask your questions, anything that's coming up for you. Last thing I just want to touch on, we will not be covering any billing questions today. So because IRIS does not handle billing for your organization, that is going to be something that's very specific to your organization. So get with your manager or your supervisor if you have any billing questions. I know those do come up during your patient conversations, but unfortunately we can't speak to that because it is going to be specific to your organization. All right. So Corey, what are we going to be talking about today?
So we're going to be going over how you present the exam to the patients. We'll explain, what the exam is, what's going to happen, those type of things. We're also going to conclude. We're also going to conclude the exam and kind of go over that. What happens next, and then frequent last questions. Of course, we will go over all of those that you'll have. We do have a poll. So do you want to?
Yeah, absolutely. So we kind of want to get a better understanding of the workflow that you all are using in your clinic. So we're going to go ahead and just do a quick poll. This is about your specific workflow. So who is going to be the one who is presenting the exam to the patient? Is it you? Is it your provider? Does it depend on the situation? And then a little bit more specifically about your workflow. Can you place the order for the exam? And do you need someone to sign the order before you can do the exam? So go ahead and take a few moments to answer the questions on that poll. Obviously, again, this is going to depend on your organization, but we just wanted to get a better understanding of the workflows for those of you who are joining us today. Give just a few more moments for you to lock in your answers. All right. I see a few people still answering, so I'm going to give just one more moment and then we'll end that poll. All right. So it looks like there's a lot of autonomy available to those of you on the call. Many of you are the ones presenting the exam to the patients, or you're sharing that responsibility with your providers. Looks like most of you can place the order for the exam, and it's about half and half on whether you can perform the exam without additional sign off. So Pretty good information to have there. So a lot of you are going to find this next section very relevant since you are assisting with presenting the exam to the patient and getting them to agree to have that exam performed. So Corey, what are some best practices when we're presenting the exam to the patient?
So normally you want to make sure the patient is above the age of 18 and also they have at least a diagnosis of type 1 or type 2 diabetes. And this is primarily for insurance because insurance will cover this multiple times a year. So we need those two requirements. Now, if they're self-pay or they want to pay your self-pay price, of course you could do it for any age. It's just that's what insurance would normally cover. So we definitely need the diagnosis. Whenever we're presenting this exam, I always prefer that you don't call it an eye exam. It is not an eye exam. It is a diabetic health check. Because if you call it an eye exam, a lot of patients are going to say, I just got my glasses. A lot of times optometrists don't always check the health of their eyes, or they want to charge you additional fee. So this is not charged under an eye insurance. It's charged under health insurance. So it's a medical exam. So it all falls under that purview for us. So those are kind of the start of the things that how we present it. So number one, we want to call it a diabetic health check. It is an important part of of their diabetes because diabetes can affect any part of your body. Number one, I always ask my patients, like, if they have any pushback, I'm like, automatically, how of your five senses, sight, sound, taste, touch, and hearing, which one would you have a hard time getting to this office without? You could do it with four of those. One would make it really difficult. So, I mean, just presenting it in a way that makes them understand the importance of it. But I also like to say, just like when you do an A1C, you don't ask them, you tell them, right? You direct them, say, hey, you're due for the A1C. We're doing it right now, right? That's what this should be a part of as well. Should be part of their annual diabetic health check. You do A1Cs more often probably, but once a year, this is required. We need to do this. And you can now be a one-stop shop for everything. So it makes it much easier. Would you like to add
Yeah,
something?
absolutely. And so, like Corey said, helping the patient understand that this is part of their health maintenance as it relates to their diabetes. This is just as important as receiving the A1C, the foot exam, because you can complete it in office. It'll just take a few minutes and it will help ensure that they do not lose their vision from their diabetes and making sure that they understand that, this is not something that's going to take a long time. It's not going to add a significant, burden to their appointment. We're just going to take a few pictures of your eyes real quick to make sure that diabetes is not affecting your eye health. And Corey brought up another good point about identifying, this is a calendar year. So if you've got a patient, maybe they were there in May of last year and they're back in April, maybe they're just, one of those patients you maybe only see once a year, you can do it in the calendar year time frame. So when you're identifying those patients, making sure, is this a patient that has that gap? If they're not someone that's got a relationship with an eye care provider, that's our target audience, and that's a good number of people because less than 50% of patients are taking that referral. So if you do have a patient where they've got a relationship with an eye care provider, they're getting this exam done, you're getting those records, reconciled, then that's not our target, right? These are those patients that are not having that done. So like Corey said, you can be a one-stop shop, close those gaps, provide better patient care, and help your patients understand what's going on with their eye health. So,
And one of the reasons it's so important is because we see probably 50% of the diabetics out there actually get this exam done annually. So there's a whole large swath of people who don't, and those are the ones you're trying to reach. Because if you referred out 100, probably not 100 will go to that referral. Probably maybe half or even less than that,
yep.
So you are trying to you're trying to do this for those patients because a diabetic does not know they're going blind until it's way too late. When they realize it, it's going to be too late. They're on the wrong side of this.
Absolutely. You can incorporate this exam in any type of visit you'd like. So that's another thing that's really great is you can customize your workflow. So you can include this in, annual wellness visits. You can do this as part of diabetic follow-up visits. You can do it anytime that they're in your office. It doesn't have to be a special appointment. And in fact, most of our clients are incorporating this into regular visits. You've already got the patient there. You're already doing other procedures and tasks. Go ahead, just tack this on. Just takes a few moments and you can close that gap. So Once you've identified your patient, once you are about to perform the exam, the next thing that we want to make sure of is that they clearly understand what's going to happen during the exam. And this is something that you're already doing for all sorts of processes and procedures. You know, you're explaining things, you've got a running dialogue with the patient, you're helping them understand what's going to happen, what their role is in the exam. So again, like Corey said, you know, try to shy away from saying things like vision test, vision exam, eye exam. That does cause confusion because then they think we're checking their vision. And so I like to say, you know, we're just checking the health of your eyes. We're going to take a few pictures of each of your eyes to make sure that diabetes isn't affecting your eye health. I never say one picture because I want my patient to anticipate the chance that I might need to take multiple photos. So as you know, if you capture a blink, if they've got small pupils, if you identify maybe there's something on the lens, you may need to take additional photos. So I don't want my patient to be surprised by that. So I always say we're going to take a few pictures of each of your eyes. I let them know that they're going to see a flash from the camera, just like from a regular camera. I know it's kind of intuitive, right? We think, oh, well, I told them I'm going to take pictures. They should know there will be a flash, but it's helpful to specify that because the flash is surprising sometimes to patients. And then I also like to let them know that they won't experience any pain or discomfort during the exam. A lot of people get concerned that we're going to puff air into their eyes. And so I like to let them know that that's not going to happen. So making sure that they understand what's going to happen during the exam and then giving additional direction depending on your camera type. If you're in a tabletop camera, then that patient's going to have to help with positioning, making sure that their chin is in the chin rest appropriately, that their forehead is against the bar, that they're looking in the correct location. With handheld cameras, they'll need to know you're going to get pretty close to them. They're going to feel you touch their forehead to steady the device. And again, they need to know where to look. If you've got that internal fixation, you know, letting them know to cover the other eye. So again, clear explanations are really helpful. So we kind of touched on a few of the questions that we see a lot, but we wanted to hear from you on what are some of the most common questions that you receive when you're doing the exam. And so we're going to go ahead and launch our second poll. You're able to select multiple options here. So choose as many as you like. What are the most common questions that you receive from your patients when you are explaining the exam? Yep, that's a very common one. So patients definitely are curious whether you can see anything in those photos. Definitely one of the top answers we're seeing right now. So we'll give just a few more moments for everyone to lock in their answers. Again, you can select more than one. So what are some of the most common questions that you receive during the exam? And then we'll go through these a little bit more in depth. All right. Okay, so we'll go ahead and end that poll and share the results. So definitely some of these are, you know, kind of tied, but we've got some clear winners. Oh my goodness, there's a typo in my poll. I'm glad you all knew what I meant to say. So top question that we received is patients wanting to know if we see anything in the photos. So Corey, you took a few photos of my eyes. What did you see in the pictures?
I see the anatomy that I need you to capture, and somebody else will grade it. So you guys, you are not here to grade photos. You are, my joke is always, you're ocular photographer, you're an eye photographer. You're just taking the photos just like you do an EKG. You're not reading it. You take blood, you're not like understanding what it is. You're just taking a photo. If they say you see anything, I see the anatomy, moving on, you know? We don't want to give them any openings to allow them to ask more questions because there's nothing that, you know, you're not here to interpret it.
Yeah, absolutely. So I will frequently, just kind of let them know, again, like Corey said, we see the anatomy that we need to see. We're going to send these off to an eye specialist. So I'm not qualified to interpret the images. This is just like other processes. If you are doing an EKG or something like that, we're not able to deliver those results real time. So it makes sense that your patients want to know if we see anything, but another thing that I will not do is I usually will not show the photos to the patient because I'm not able to adequately explain what's happening in the photo. And there may be questions that they have that I'm not prepared to answer. So I keep those a secret. I take the photos we need to take and upload them and let them know that we will let them know what the results are as soon as we can. So speaking of results, we are delivering those to you within 1 to 2 business days, but how quickly you can turn that around to your patients is going to depend on your internal workflow. So that's another question that we get a lot. How long is it going to take for me to know what did come up, if anything, in this exam? So make sure that you give yourselves a bit of a buffer. Again, Iris will have those results to you pretty quickly, but you're going to want to make sure that your providers have time to review those results and then that you have time to deliver those back to the patient. So go ahead and tack on a little bit of extra time. All right, next most common question. How long is this going to take, Corey? I got places to go. I got people to see.
It really depends on the patient itself. A lot of times with this exam, I could be done in less than 3 minutes to 5. That should be a standard for a majority of your patients because in a dark environment, their pupils are going to dilate. And if their pupils are nice, this is going to be very easy. Now, speed does come into play. The more you practice and the easier it is for you, the more efficient you'll be and the faster you'll be. So it does take practice to get comfortable and confident because you will learn how to move the camera, how far to push in, when to press the button. If you master those 3 things, this can be done in no time, right? So how long does it take? As long as it takes. but realistically, when you're talking about dilation, which I know this isn't really about dilation, but sometimes when you go in and talk to your patient and you get ready and lay in the camera, you can see how big the pupil is, or you may have a desktop that tells you how big the pupil is. If you can move forward or if you need to pause and allow dilation a little bit longer, which then can extend the time, but we're not talking 15, 20 minutes. This
Right.
exam should be a max like 11 minutes, but most of the time, probably 4 to 5.
So again, give yourself a little bit of a buffer. Let them know, 10 to 15 minutes max, not a significant amount of time. It frequently takes less time. So really, it's just a matter of, your comfort with the device. And then again, like Corey said, how big your patient's pupils are. But if you say 15 minutes or less, you're definitely going to be able to complete the exam well under that time, the majority of times that you're doing it. So again, not a significant add to your patient's time with you, especially since this is just a once a year kind of thing. Another common question patients ask is, do I need to remove my contact lenses? So that is only going to happen if you are using dilation drops. Regular contact lenses during an exam where you're not using dilation drops, your patients do not need to remove them. It's not going to interfere with the exam. So the only time that that is going to happen is if you're administering dilation drops, and that's just so the drops can make contact with the eye. So once the drops have been administered, your patient can put their contact lenses back in. Otherwise, they don't have to worry about that. So it's going to be a very, very, very small percentage of patients. And then, kind of neck and neck, is this going to hurt? And are you going to blow air into my eyes? And for me, those questions are kind of related. So, Corey, what do you say when patients are asking you that?
Anytime, like I honestly, when I'm explaining the process, I always warn them of the flash, which that's the most painful thing. It's not even painful. But I also want to tell them that there's no puff of air because everybody automatically, you're getting closer to that. I don't want that puff of air, right? So I just warn them beforehand so I never get that question. But if you do, no, there's no puff of air. There will be a bright flash. And then you're just explaining, what that process is. But never pain. There's nothing that's going to hurt them. They may just have be a little uncomfortable with a bright flash, but once you've had it done, it's not a big deal.
Absolutely. And that flash is not causing any pain. It's kind of a little annoying sometimes to some patients, depending on your camera and how bright it is, but that's a very easy trade-off, right? A few bright flashes in your eyes to take photos or going blind. Like that's a pretty easy trade-off. Like for me,
Yeah.
that's a no-brainer.
And if you warn them, they're not going to be over dramatic. If you don't warn them, then they're going to be overly dramatic about it. So definitely give them warning so they know what's gonna happen, and then they're not surprised.
Absolutely. And then the last question that we see a lot is, questions around vision tests. Are you going to be able to tell me if I need new glasses? Is this going to give me a new prescription? Does this take the place of my annual exam for my glasses for my vision? And so we just need to make sure that the patient understands that this is a medical exam. We are looking at the back of the eyes. While this does help make sure that diabetes won't ultimately impact their vision, it is not a vision test. And so, like Corey mentioned earlier, this is billed under medical insurance. It's not billed under vision. So we are really just checking the health of their eyes as it relates to diabetes. And again, the language that we use presenting the exam can help alleviate some of those questions. So if your patient is wearing glasses, if they go to the optometrist, they should still be honoring those appointments. They just don't have to worry about getting their diabetic eye exam there because you've already completed it in office.
And certain optometrists will charge an additional fee to check. Some will check it for right away. But how before they used to come to you to get this exam, you would refer them out and they would go to a specialist. So they're paying a copay here, they're going to pay a higher one at a specialist, and that's also more time off work. So with you becoming that one-stop shop, you literally are saving them time and money by just taking a few more minutes to do an additional exam that is beneficial to them. Because again, eyesight's very important. They don't want it to be impacted or affect, you don't want diabetes to affect their eyesight. So that's why this exam is so important. And you see all the diabetics more than anybody, and they're honest with you. They tell you they're diabetic. So they're going to, you doing this exam is going to benefit them.
Absolutely. The last question that we didn't have on the poll, but we hear a lot, is patients are curious about whether or not you're going to dilate their eyes using dilation drops. And that's going to depend on your organization. So we have clients that are only using natural dilation techniques. So in that case, you're never using drops when indicated. So you would say, no, we're going to use natural dilation techniques to try to get your pupils to open up so we can take photos. If your organization allows for dilation drops when they're indicated, then the answer would be maybe. So depending on the patient's pupil size, you may need to use drops or you may not. So one of the things Corey and I are big advocates of is getting an understanding of how large your patient's pupil is as quickly as possible. So once your patient is in the room and you're ready to perform the exam, usually I'm explaining the exam to the patient in a darkened room. So I'll bring the patient into the room. I will get them seated wherever it is they need to be seated for the exam. Again, if you're using a tabletop camera, there's a chair we want them in. If you're using a handheld device, again, a regular chair, but I want to get them seated and secure. And then I'm turning that light off as fast as I possibly can. And I'll leave the door cracked, or I'll leave a computer monitor turned on, or if you've got a red night light, that'll give you some ambient light where you can clean the equipment, you can explain the exam, you can answer their questions, all while their pupils are already dilating. And then at that point, I'm going to go ahead and try to take photos. If I'm using a tabletop camera that tells me how big my patient's pupils are, as the camera is getting into place and I'm seeing that feedback, if their pupil size is adequate, for most of our cameras, it's going to be 2.8 millimeters or higher, then I'm going to let the camera take the photos and we're going to be good. If you're using a handheld device, then your camera is going to show you in the center of their eye, right? That target that you're aiming for, that glowing pearl, that glowing retina. So if you see a really nice big pupil, then you can go ahead and take the photos, right? And move on with your day. And so this will also help you with the speed of the exam. And so again, coming back to that question about dilation, you can say something along the lines of, we're going to check your pupils. If your pupils are big and I can get photos, we won't need to use drops. If you've got smaller pupils, then we may need to use drops to help get your pupils bigger so that I can get good photos. So for those organizations that are using dilation drops, it's typically going to only be about 10% or less of your patients. So again, not a significant percentage of the population, but it is nice to have that option when it's indicated for those organizations that are using dilation drops.
Now, just to tag two things onto what she just said. Yes, ideally, we love you to go into the room and be in there with the patient, turn out the lights, explain everything. But sometimes your provider may turn out the lights and keep the patient in there. We like you to get in there ASAP so you can then get that done. Because for a patient sitting in a dark room in an office, that's not the best experience for them. So we want to help that experience and see if we can take control of that time and get it done much faster than having them just sit and wait in a dark room. So just whatever workflow happens for that patient, go with it. But the sooner you get in, the sooner you can get the exam done and the patient can get moving on. Now, the second part was, I'm sorry, I just lost the thought. um, the I lost it. Sorry, I'm out.
We'll come back if you remember.
Yes.
All right. So now we're going to talk about concluding the exam. So, Corey, when the exam is done, what are the next steps that you take to explain things to the patient and conclude the exam?
Well, I like to explain like when the results are going to come back, and where they're going. They're going to a retinal specialist who's going to grade the exam and provide us the results back. Normally, with Iris, we will have the results back normally within 24 hours. Our goal is within 48. That's like our kind of our guarantee. But if you were talking to your patient, I would give yourself a little buffer. Say, hey, it'll be within the week, or in a week we'll have the results because you're going to get the results earlier and they're going to get the results right away, even though you set them up for that. That sets you up for success and you not getting those phone calls, hey, where's my results? Where's my results? So it'll make it a little bit easier. But yeah, just informing them of that is can be very helpful.
Absolutely. So again, letting the patient know what's going to happen next. These images will be reviewed by an eye specialist. We will get the results back and then we'll reach out to you, or your provider will reach out to you to let you know what, if anything, was identified during the exam. The next thing, I will typically crack the door open before I turn on the lights. So I don't know if this has happened to any of you. You're in that dark room, and then suddenly you turn on the lights and everybody's eyes, dilate or, lose that dilation really fast. So that can be a little jarring for me as much as the patient. So I'll crack the door open and kind of, just like we gradually dilated the eyes at the beginning, I'm going to gradually reintroduce light. So I'll crack the door open, and then after just a moment, I will go ahead and turn the lights on. Because you flashed a bright light in your patient's eyes in a darkened room, they might say that they can see spots or that there's, a little flash of light. That's totally normal and natural. That will dissipate pretty quickly. A trick that we've learned is once you have turned those lights back on, your patient can actually look up at the light and that'll help wash out any spots that they see. But again, those will dissipate very quickly. Your patients can walk out of the room, they can drive. There's no harm in having taken photos of their eyes. So again, no pain, no discomfort, anything like that. So those are kind of our best practices on ending the exam. We actually have a script that you can use to help you with having these conversations. This is also very helpful when you're cascading training to your colleagues. So anytime you've got someone new coming on board, you're teaching them how to use the camera, they're trying to develop their own script for the exam. We have a template that you can use. This is not by any means what you have to say during the exam, but it is something that you can use as a reference while you develop your own way of presenting the exam to the patient. So this is something that's available from Iris that you can use for reference. We will send it out in a follow-up email to all of you in attendance today. So we have plenty of resources about all sorts of topics all the time. If you ever have questions about anything, whether it's dilation, image quality, patient discussions, Iris has a resource for it. We've got scripts, we've got handouts, we've got videos. So don't ever hesitate to reach out to us if anything comes up in your day-to-day and you've got questions.
I remembered what I was going to tell you. I'm sorry. All right. So this is mainly for the clinics that do dilation drops, right? So anytime you administer dilation drops, if you have the ability to leave a note in your EMR or some way about the patient, make sure you notate that you provide a dilation drop. So when the next time they come in, potentially when they show up in the waiting room, you could grab them and do the dilation drops. That patient can go to their provider, can go maybe get a blood test or whatever they have to do. And then at the end, they can come see you because the medication is taking effect the whole time. So it's a great way of kind of balancing their time. So you're not administering the dilation drops at the end and making them wait the full time. You could do it early and then let that medication work. And then when they can come back and see you, you can just do the exam really quick and moving them on. Sorry.
No, that's great. That's perfect. Absolutely. Anything that you can do to communicate things so as you're conducting these exams throughout the years, you're kind of setting yourself up for success there. Just a quick reminder, if you have questions, go ahead and access the Q&A box at the bottom of your screen. You can type in your questions. We'll be happy to answer them here live. In the meantime, we're just going to go ahead real quick and do a quick run through of everything that we've talked about for the exam. So Corey, do you want to be the patient or the camera operator?
I'll be the patient.
Okay. So I'm just going to grab one of our handheld devices. I'm not going to take photos or anything, but we'll just use this for demonstration purposes. So Corey, thanks so much for coming in today. We're glad to have you. My name is Lauren. I am going to be conducting a diabetic eye exam or a health check on your eyes today. So essentially what we're just trying to see is whether diabetes is affecting your eye health. This exam is not going to take very long. I just need to take a few pictures so that we can get an understanding of whether diabetes is affecting your eye health.
Sure.
All right. So is that going to be okay today?
Yeah.
Awesome. Good. Because you didn't have an option. I'm just kidding. All right. So Corey, I'm going to need you to remove your glasses. And then for the exam, we do want to make sure that we're cleaning any equipment with an alcohol prep pad. So you're going to clean the edge of the eye cup for those handheld devices. You're going to clean the forehead and chin rest for those tabletop devices. So Corey, during the exam, you're not going to experience any pain or discomfort. There's just going to be a flash of light when I take the photos. So you will see that flash when I take the photo, but otherwise no puff of air or anything uncomfortable. I'm going to get pretty close to you during the exam. You're going to feel my touch on your forehead. That's just to steady my camera. And so during the exam, you're going to be looking for a blinking light inside the camera. When you see that light, I just want you to focus on it for me.
Yes, ma'am.
All right. Any questions for me today?
I'm good to go.
Okay, so I'm going to have you cover your left eye for me. Go ahead and look for that blinking light. And then I would take the images. And then once we're concluding the exam, I would upload the images. And then I would just let Corey know what's going to happen next. So Corey, we've got some images that we're going to send up to that eye specialist for review. Once they've got a determination, they're going to send those results back to your provider. And we'll reach out to let you know what happened, what they saw, and what needs to happen next.
What'd you see?
So that's a great question. I'm actually not able to interpret these photos. I just know what anatomy we're looking for. So I got the anatomy that the doctor needs to see, and I'm going to send that up to them. Okay. All right. Thanks so much for taking a few moments today to make sure that diabetes is not affecting your eye health.
Perfect.
All right. So it's a pretty quick explanation, as you can see, and feel free to tailor it to your needs, your organization's workflow, what you feel comfortable saying to the patient. These are all just suggestions that you can use to kind of help you develop your own best practices. All right, I don't see any questions in our Q&A. We are going to give just a moment to see if anyone has anything. As I mentioned earlier, there are a lot of resources that are available to you from IRIS. You can access our video modules anytime in the IRIS portal. You can also get links to those videos individually from us, from support. We've got a lot of written material, step-by-step guides on performing the exam, guides on image quality, patient education resources. So there is a wealth of information available to you from us. You can always reach out to our support team either by phone or by email. If you give them a call and they don't answer, your voicemail does leave a ticket for them, and they're very responsive. So please don't ever hesitate to reach out to us. All right. So a couple of questions coming through. The first question is about dilation. How long does the patient need to sit in the dark? Corey.
It really depends on the patient. To be honest, if like the path she said, bring the patient in, sit them down, and you explain in the dark, explain, what we're doing, why we're doing, and how we're doing it. you're buying dilation time while you do that. And then if you're using a handheld, you get to land the camera and you should be able to start recognizing how big the pupil is and what a small, medium, and large. That's pretty much for any handheld. For our tabletops, when you get ready, you can get them all set up within a few minutes and you can start the process. And most tabletops will tell you how big the pupil is. So depending on your camera, you know what your kind of green light and red light is. If the pupil is too small, you're going to stop the exam. You know, for you, if you're with a handheld and that pupil looks rather small and you're going to struggle to capture it, let's give them a little more time to allow those pupils to expand a little bit more in the dark. But every pupil is different. So, you know, every eye is different. I would probably say about 80%, you could probably have this exam done in less than 5 minutes. And there's probably another 20% that would need longer, you know, or dilation drops.
Absolutely. So don't think that your patients automatically have to sit in the dark for 10 minutes. Like Corey said, the sooner that you can get an understanding of how big your patient's pupils are, the better that you will be able to maximize your time and make sure that you're only adding additional minutes in the dark for dilation for those patients who need it. Because a good portion of your patients will dilate very, very quickly. So the sooner that you can see how big their pupil is, the better you can understand how much longer, if at all, they need in the dark. So don't just stick them in a room for 10 minutes right off the bat, because a lot of your patients don't need that much time.
They'll hate you.
All right. So another question about lens cleaning. So Corey, how often do we clean the lens?
We clean it when it's dirty is primarily what we want, but we should be checking it a minimum of once a week to multiple times, depending on the camera you have. Some of the tabletops, I would check it daily, just because the lens is so close to the patient. And unless you have a lens cover, dust may show up. So you need a flashlight to check it daily. Some of the handhelds, I would say check it at least twice a week, Monday morning and Wednesday morning, to always make sure it's clean. You never want a non-gradable to be due to a dirty lens, because that is 100% your fault. That is not a patient issue. That should never be an issue of why it's not gradable, because that is your fault. Easy to control, easy to manage. It literally takes a flashlight to look at it. If it has dust, we use an air bulb. You know, if it's extremely dirty, that maybe has a smudge on it, or, you know, sometimes like with tabletops, when patients' chins are here and they try to talk to you while you're doing an exam, they will spit, and that'll get on the lens. So you only have to clean it when it's dirty. Using a flashlight is going to be your best friend, because you can always see the dust and smudges or anything on the lens that's reflective. Now, if you see that in your photo that you captured, pause the exam, clean the lens, and then restart the exam, of course.
Yep. And so the question also asks, what do we use to clean the lens? So Corey already kind of touched on this. We want to be in a darkened room. We want to use a flashlight to identify what artifacts are on the lens. So if you're in a bright room, if the lights are on, you're going to have a harder time seeing some of those smaller artifacts, dust nodes, and smudges. So turn the lights off. Use a flashlight to evaluate the lens. If it's just dust, you're going to use an air bulb like Corey's got here. And that dust will be taken away from that air bulb, blown off, yes. If you see smudges or there's dust that's not being blown off by the air bulb, you're going to use a wet lens wipe followed immediately by a dry Kimtech wipe. And so when your clinic first goes live, Iris will send you these supplies to kind of get you started. If you've been doing exams for a while, you may have had to clean the lens so often that you have run out of supplies. In that case, you're going to order replacements from your medical supplier. The wet lens wipes do not have to be the same brand that we send you. It's just got to be a comparable item. And then you want to follow up immediately with the dry Kimtech wipe. Do not let the lens wipe dry on that lens. It will leave behind residue. And the last thing I always like to touch on, please do not clean your lens with an alcohol prep pad. Alcohol prep pad is only for the parts of the camera that touch the patient. The lens does not touch the patient. It needs to be cleaned with special materials. An alcohol prep pad will not effectively clean the lens. It will actually make the lens a lot dirtier. So don't use that.
And if you can't find, again, we're really looking for like a glasses lens cleaner, but also anything for a microscope will be beneficial too, because that's a high quality lens, just like in the cameras. So if you can't find anything like specific like what we have, finding what would be used is from on a microscope from your medical supplier will do as well.
Absolutely. All right, another question regarding feedback from the camera. So it's asking about one of our handheld devices. It says the green dots will not necessarily mean that it's gradable. Is this correct? So that is correct. If you are having feedback from the camera regarding the quality of the image, that is a nice thing to look at, but it is not the determiner of gradability. So the green dot is specifically looking at the focus and clarity of the image. But that does not mean that the anatomy is in the correct location or that you can see all of the anatomy. So it's very, very important that you are always evaluating the image for the quality that you know to look for. And we talk about this a lot in our training sessions and in our videos about image quality. You need to make sure that the 4 parts of anatomy are present, that they're in the correct location, and that the image is clear and in focus. So while some of the cameras do give you feedback, what it thinks about the photo, it's very important that you are evaluating the image for quality, because that is not a guarantee of gradability or not gradability, right? So we want to make sure that we have a clear understanding of what it is we're looking for so that we can make good judgments about the quality of the images that we're capturing.
So even if it does have a red dot, you can still successfully submit that one and it can be graded. It may be missing a part of anatomy or maybe just something the camera's being picky with. You're always smarter than the camera, what I always like to say. So you just scrutinize if you get the red dot, scrutinize it a little bit more. But if you have most of the anatomy or all the anatomy, it's still very acceptable to submit.
Absolutely. Next question regarding one of our handheld devices, whether the best mode is going to be automatic or manual image capture. That's going to depend on you as a camera operator. So it really is just a matter of personal preference. Some operators prefer manual because they want to be in control of when the image capture process takes place. Some prefer automatic capture because the camera is assisting you with that. If you are in auto mode, you can always tap the button again to override. So it's completely up to you. There's no best option. It's really about what you want to use. And we've even seen clinics where some operators prefer one and some prefer another. So I invite you to play around with those, see what one works best for you. It's all about your comfort and proficiency with that device.
Practice, 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 and you get to try them both. So see which one you like the best.
Absolutely. All right, another question. This is regarding a patient with implanted lenses. So frequently when your patients had some type of surgery like cataract surgery, they get a lens that's implanted in the eye. And so this person was getting a reflection from the lens, Corey, a rainbow effect. Yep. So talk about what they can do to prevent that.
So number one, it's normally going to be because that artificial lens creates light refracting off of it because it's not non-reflective. So it does get reflections. I always, whenever I kind of describe it, think of a window with 12 panes, right? And as you're walking up, you see reflections off all of them. Your goal is to get to the one. So you really got to push through all those lights and flickers. But if you are in that sweet spot and you have a rainbow arc that's maybe blocking part of anatomy, treat it like a shadow. Let's try a second photo capturing what was missing because that rainbow is blocking it. Slight angle adjustment will move that rainbow to a different side of the eye, and then you could submit multiple images to get what you need. But really, a lot of it's about you just have to kind of push through all that to get to that sweet spot, and you're going to kind of go through some flickering. Sometimes it just depends on the lens, but sometimes you really got to push through to get to where you need to go, and that's primarily for handhelds. Desktops, a little different, but they do a little bit better job on capturing those.
Absolutely. So like Corey said, don't let that reflection prevent you from continuing to advance the camera forward. Align with that retina, push through depending on the thickness of the lens. If you are getting a rainbow effect on the images, like Corey said, you can take multiple photos to show a comprehensive view of the anatomy. All right, next question. If I have images for one eye and not for the other eye, is the exam still gradable? So this is kind of a complex question. Our recommendation is always to take the best photos you can. So really, you should only be submitting images for one eye if the patient only has one eye. The exam will be graded if the images only come through for one eye, because there are going to be patients that maybe they have the prosthetic eye or they don't have another eye. And so single eye orders will get graded. If that single image is gradable, then the exam will be gradable. But I do want to highlight here, it's very important. If you don't feel like you got high quality images of the other eye, take the best photos you can. It is very important that we show the interpreting provider all aspects of anatomy that we can, even if those images are not ideal. Because if there's pathology present in those images, and the interpreting provider can identify that pathology, they will be able to indicate it on the exam. So if your patient has two eyes, we should really be trying to take the best photos we can of both of those eyes and submitting them. All right. We do have a few questions regarding specific organizations, so we will be answering those in a follow-up. So if I don't answer your question live, I will be following up with you after the session to make sure that we get those questions addressed. Last question that I'm seeing that kind of may apply to everyone is regarding connection problems. So usually we're seeing two different types of connection problems. The first type of connection problem that we see is usually with this handheld device, that's the Remedio. And so we'll see connection problems between the iPhone and the camera. And so those use Bluetooth to communicate. Usually what it means if you see device not connected on this camera, it means that the front switch of the device is either turned off or it's been turned on for too long. So it's really important to leave this device off when it's not in use and then turn it on right before you're ready to take photos. The other type of connectivity issue we see is usually with image upload. You may have some Wi-Fi connectivity issues. That's obviously going to be more specific to your IT setup and your Wi-Fi connection than it is to Iris and our setup. If you have connection problems, please reach out to our help desk if you need assistance troubleshooting. We will be able to identify if it's something that Iris can address, if it's something with your machine, or if it's something that you need to loop your internal IT team in on. So connection problems definitely can occur. If you are not able to troubleshoot those effectively in real time, please reach out to us. We are happy to help. Another question regarding the Remedio device, does it matter if we turn the camera or the iPhone on first? I will say my personal practice is I get logged into the iPhone, and then once I'm on the image capture screen, that's when I turn the device on, because usually that will establish that Bluetooth connectivity in real time. So that's how I personally approach it. You can turn the device on first and then log into the iPhone, but sometimes you will see that Bluetooth connectivity be a little bit wonkier when you do the camera first instead of the iPhone. All right, lots of great questions. Really glad that we're able to address some of these real time. If you have any other questions, feel free to submit those here. And again, if you asked a question and we didn't address it live, I will be following up with you after the session. I don't see any other questions coming through. All right. So again, we just want to thank you all for joining us today. We know that you're very busy. You've all got a lot going on. And so the fact that you took your time to come join us for this webinar means a lot to us. We're happy to help. We hope that this has been a valuable resource to you. Please feel free to continue to join us for future webinars. Like I said, in November, we'll be hosting Dr. Gross. We'll talk about different types of pathology, how it affects patient vision, various treatments for those types of eye diseases, and the importance of early detection. So you all are making a very big impact on your patients by performing this exam. And so we really appreciate all that you're doing in your day-to-day to help save your patient's sight. We will be providing a recording of this webinar in the October newsletter. And as I mentioned at the beginning, we have all of our webinars on our YouTube channel, so you can always access any topic. We do frequently go over topics more than once because we like to share new information as we have it and make sure that we're addressing questions as they come up. So we will include that in the October newsletter, as well as a link to all past webinars. So thank you again for joining us. We really appreciate all of you, and we hope you have a wonderful day.